Demonstration of the bioequivalence is must for the generic formulations. It is also to get the bioequivalence for novel formulations for the lower strengths, and demonstration of bioequivalence is also needed when some significant variations are made to the already approved formulation. These variations are called as SUPAC changes as well. So bioequivalence can be demonstrated by performing in vivo studies in the human volunteers, maybe healthy volunteers or patients. Sometimes clinical studies are required. So bioequivalence can be of two types, or we can say that it can be of two types, or we can demonstrate bioequivalence by two types. So first is in vivo bioequivalence studies, and second is in vitro bioequivalence studies. So in vitro studies doesn't involve human subjects. So then how and why in vitro studies can demonstrate the in vivo bioequivalence? When there are certain regulatory requirements for bee studies, generally in vivo studies are required. But in vitro bee studies can be performed, and these studies can be used when in vivo studies are not necessary and not required by the regulatory authorities. So these are the surrogates for in vivo bee studies, and these in vitro bee studies predicts bioavailability through dissolution testing, drug release testing, and the other product specific testings. These in vitro bee studies supports the generic approvals, and these studies demonstrate equivalence to the reference listed drug, that is RLD, or reference formulation, or the comparator product. So how these in vitro bee studies are performed and what are the studies involved? First is dissolution testing. As we know that for the oral formulations, dissolution testings are of much importance to prove in vivo behavior. Dissolution testing conducted in multiple pH conditions like 1.2 pH, 4.5 pH, and 6.8 pH, and then the results are compared. Comparison of dissolution profiles is done by using F2 similarity factor, and when F2 similarity is not possible or feasible, then other dissolution comparison techniques can be used like bootstrapping, MSD methods. Also, now the advanced techniques like PBPK modeling is being done. Then after dissolution testing, permeability testing can be performed. CACO2 cell permeability studies for BCS class 3 drugs. Many of the times BCS based bioviewers are given for the formulations, and these BCS based bioviewers require only the in vitro studies to prove the in vivo bioequivalence. Then release testing from the complex dosage forms. In vitro release testing for transdermal formulations, inhalation formulations, and modified release formulations. Also, in vitro testing like dissolution testing can provide the in vivo equivalence for the non-RLD strength formulations which are used for the biowaivers. Study requirement and acceptance criteria. So what is the acceptance criteria? Q1 Q2 sameness, that is qualitative and quantitative equivalence to the reference formulation or RLD. Then Q3 sameness is also required for some of the topical and transdermal formulations. I have made videos on Q1 Q2 sameness and Q3 sameness. Then comparative dissolution profile. So as per the F2 value calculation, we can show the dissolution similarity. In vitro B study for non-oral formulations or non-oral dosage forms. So the complex formulations which are administered through non-oral route like nasal sprays, inhalers, topicals, transdermals. These formulations are required to demonstrate certain tests, and based on these testings, the in vitro bioequivalence can be demonstrated. Nasal sprays and inhalers testing is done for aerodynamic particle size distribution and spray pattern. Topicals are tested for in vitro release testing (IVRT) and in vitro permeation testing, that is IVPT. This slide or this video is for the basic understanding about in vitro bioequivalence studies. I will make more elaborative video on in vitro B studies. This video will give you some information regarding the in vitro testing to demonstrate in vivo bioequivalence for some of the formulations. It is not like that. If you prove the in vitro bioequivalence by doing some testing, regulatory authority will directly uh, give the marketing authorization or grant the product or approve the product based on to the formulation, based on to the route of administration, and based on to the testing results. More studies can be required. This was a very basic informative video for in vitro bioequivalence. Thank you for watching this video, and let's meet soon with in detail video on in vitro bioequivalence. Thank you.